All right. Well, thank you all very much for joining us today. This is Henry Overton with Turnkey Solutions. We are so glad for you to have joined us today as we talk about some very important things for the healthcare practice managers, CEOs, CFOs, and everybody in the industry that is affected by HIPAA compliance, high tech, and all the things that are related and associated with that. My name is Henry Overton, and I'm joined by Tim Barrett, the CEO of Radiology Associates here in Louisiana. Thanks for joining us today, Tim.
Thanks, Henry. Thanks for having me on today. I look forward to a good session.
All right. Well, very good. I am as well. There's kind of three big things that I want to make sure we cover today. First off is the new work-from-home compliance threats. After all the quarantine and COVID-19 craziness, there have been so many changes to our day-to-day work environment, and we're going to address how some of those changes have introduced some very dangerous and real threats to the home network and to the corporate networks that they're associated and connected to. We're also going to talk about a few very ancient, in the grand scheme of things, HIPAA compliance concepts and rules and standards that not many people are doing very well, and this is a great opportunity to readdress some of those. And finally, we're going to address some very hard decisions that all of us are having to make in these, quite frankly, challenging times. So that's kind of the high level of what we're going to talk about. At a little bit more fundamental level, what I really want to make sure we talk about is how to avoid being just a sitting duck to the HIPAA fines, cyber criminals, online thugs, and everybody else out there who, in so many ways, it feels like they're just gunning for you to take away everything that you've worked so hard for. I don't know about you, Tim, but some days it feels like it's just I'm a duck in a barrel and everybody's taking cheap shots at me.
I feel the same way, Henry.
Okay. Well, I'm glad to not feel alone and not be alone in that perspective. Not every day, but sometimes it just feels like the hits just keep coming, and you got to be strong and prepared and have a plan. So that's what we're here to talk about. If you'll hang on to the end of the webinar, I do want to make a special offer for you. We are going to be providing, if you want, a very important and very powerful tool, a free dark web scan and security report for your company and your personal credentials to show you where your important personal information is being currently sold and trafficked on the dark web. This is such a common thing that has gotten exponentially worse. We'll dig into that in a bit. But this is a very important tool that if you'll just hang on to the end of the webinar, we'll give you information about how to claim this for you and your company. Now, let me back up just a tiny little bit, introduce myself. I'm Henry Overton. I'm one of the president and one of the co-founders of Turnkey Solutions. And like it says there, we're a cybersecurity and IT support firm. Over 50% of my business is healthcare organizations across the United States, so we've been really blessed with the opportunity to learn a ton about this industry for the better part of 20 years. I graduated from LSU, don't hold that against me, and we just focused the majority of my day for the last decade plus on cybersecurity, HIPAA compliance, and kind of disaster preparedness for our clients. Tim, I'll let you introduce yourself.
My name is Tim Barrett. Happy to be here. I am the CEO of Radiology Associates. We're a hospital-based radiology practice. Essentially what that means is we don't have a great deal of patient-facing encounters, much like you would see in a typical primary care clinic since we work in the hospital. I've been out and about in business for 40 years, and the last 10 of which I have spent in healthcare. It's an interesting and rapidly changing environment. I don't think anybody on this session would deny that. is changing at an increasingly rapid pace. So we have to be on our toes, and when we aren't, it can sometimes show through in a HIPAA compliance matter.
Being on our toes, that is ultimately what we're all about. Thank you, Tim. And I've known Tim for a long time, and it's just been a joy to work with you, Tim, in all the different roles that I've known you through. So we just appreciate your work with us, and just knowing you. Every time I'm around you, I feel like I'm smarter at the end of it. I just want to learn from you. So thank you.
Ditto here.
Well, one of the things that we want to make sure is to explain the importance of this. I want to stop for just a second before we go too deep into the specific protections and things that we're going to recommend, and just explain the landscape. Over the last year or so, things have gotten worse, and over the last certainly 10 to 15 years, hacking and threats to small businesses, healthcare or not, have grown tremendously. HIPAA and high tech really kind of came into place in the late 90s, and that's been around for a long time. But so many other things have brought this, and the things that we're going to talk about today, really highly to the forefront. And just from January 2020 to now, the landscape has changed dramatically in just the space of 5 or 6 months. I don't know about you, Tim, but I've in my experience in 20-something years of doing this, which I'm just a short timer compared to you, but I feel like I've never seen such a rapidly changing environment.
I couldn't agree more, Henry. And what we have seen, we as an industry, over the last handful of months with the COVID-19 pandemic, are healthcare practices who have accelerated their ability to work remotely or to see patients remotely. And while I think that's here to stay in some form or another, in a much greater way, greater manner than was previously, for those who stood this service up fairly quickly, and while I applaud that, and to serve the patient and be very patient-centric, it can present some problems. And I know Henry and we're going to touch on that in just a little bit. Fortunately for our practice, radiology is a technology-rich subspecialty of medicine, and as a result of that, we have been kind of in a position all along to have that kind of technology in place. But it doesn't exempt us from some of the problems we're going to talk about, Henry.
You bet. Prepared or not, some of these things have gone faster than any of us thought they would. One of the greatest examples that we see from the IT perspective is that the idea of the growth of hackers has just gone insanely faster than anybody could have possibly predicted. Some researchers just put out a study not long ago. You can see this is from June 2, just a few days ago, that they have been studying online traffic since the COVID-19 outbreak and the quarantine. And the scary, terrifying facts are here that they've studied the search terms and what people are looking for and where they're looking for it, just as an interesting light into where hacking has grown. And what they have seen is that in some of the terms where people are trying to educate themselves about hacking have grown in some like 8 terms that they're looking for, like how to hack and how to access the dark web and how to access the dark web market, have grown to 5-year heights. Like people are searching more than they have in 5 years. Some terms and some search strings have been used more than they ever have. And what they're the terrifying kind of underlying findings is that those searches where people are pouring through the internet looking for information about how to hack, are coming from the poorer, less stable economy countries like Bangladesh, India, Pakistan, Nigeria. These are countries where there are very talented IT professionals there, but as they lose their economic support and they lose their jobs because their companies that they work for are going out of business because of the quarantine, they're turning to the next best thing that they have, which is hacking. So it is not so much that hacking is more profitable now. It's just it's more profitable than being unemployed, and it is creating a massive influx of new hackers. So and I struggle with limiting the amount of data that I put in presentations like this, because there's just always so much information to look through. But the hard facts are that this is growing faster than anybody could have predicted. What we're seeing...
I couldn't agree. Yeah, I couldn't agree more, Henry. I don't mean to interrupt, but but not only that, but the tools for the hackers are so cheap, and they make it economically attractive to somebody who isn't necessarily, one who develops these tools. You can just become a user of these tools. You can acquire them on the dark web, as you mentioned, and it's economically attractive. They're not expensive to get your hands on, and the return is pretty high. And so when you are looking at an alternative revenue stream, because your traditional revenue stream has dried up as a result of COVID or any other incident, it's kind of a crime, if you will, of opportunity to say, gosh, this is so cheap, why wouldn't I do it? And somebody's going to show me how to do this. And it's worldwide. It's not like you're trying to defend yourself against the folks down the street. It's anywhere in the country, in the world, as you already outlined.
You bet. It's just a perfect storm. There's no jobs. They're very highly skilled. The dark web has great resources for where people can download these tools, use them, buy a list, send out the hacks, and they can make more money doing that than they can staying home and being unemployed, for sure.
Mm-hmm.
Yeah. So, to put it in another way, is the hackers are growing stronger, and the market for where they are using their tools has gotten really, sadly, easier. Because if you figure now, everybody that you have at your office that you sent home to work is now working not from that big expensive firewall and router and IT infrastructure that you put in place at your office, but they're now working, your employees are working behind their home router, their home firewall, or God forbid, the Starbucks Wi-Fi, and you have no idea when they bought that router, if it was ever patched, if they ever changed the password. So all these residential grade infrastructure components that they're using. To boot, now your employees are having to communicate more electronically because they're not in the office. They can't walk up to you and say, hey, did you need something? They're relying on emails. So when they get the phishing emails, the fake scam emails that say, hey, click here to sign up for the free mask delivery that we set up the company for, or click here to download the new VPN client, they're clicking on more stuff than ever. And again, a lot of times they're clicking on that from systems that aren't as protected as they would have had at the office.
And to be fair to these practices that were trying to be responsive to the current crisis and to have a patient-centric outlook to say, hey, we can stand up working from home infrastructure pretty quick, because look, everybody already has internet at home, and they have routers and whatnot that we can put this up pretty quick. And to your point, Henry, they're residential grade. It was fast. It got us up and running, and maybe we aren't looking back, but maybe we should in terms of fortifying this a little better.
Definitely we should. I couldn't agree more. These new tools that we're using as well, and not only the home infrastructure, but the new tools are just being exploited on a daily basis. And what we're finding is that not only are we using the tools, but the organizations, due to cash crunches, attention deficit, just because they're busy trying to figure out how to make payroll. But so many of the organizations that I work with and my peers work with are just really questioning, should they spend the time and the money on security and compliance? So they're not, like you mentioned, we're not doing the basic controls for protecting those bring your own device, the BYOD stuff, and we're accessing PHI, protected health information or patient health information, in some ways that in December of 2019 we would have never thought of doing. The OCR reduced some of those standards. I don't know, Tim, you don't have to highlight the ones that specifically you're using, but are you guys using a new tool or two since all this came out?
We are. We're trying to hold meetings like most people, more remote meetings than before, to keep everybody's exposure down, since we are hospital-based, and oftentimes an administrator like myself is called to the hospital at the drop of a dime. But also trying to be cognizant of the caliber of equipment that we're using at home, and making sure that we have VPNs and what have you in place. Again, we didn't stand this up overnight. This was something that was a natural progression for the type of medical practice that we are. Having said that, Henry, we don't try to convince ourselves for a moment that we aren't also vulnerable or have areas that still need to be looked at.
Yeah, you bet. Everybody's tool sets have changed a little bit. And even then, if you haven't introduced new tools, the standard go-tos like Zoom that so many people used and loved before this have been just freshly attacked and really exploited pretty in pretty shocking ways. So from our perspective, if there was ever a time to stop and just focus a little bit stronger than we were doing in December of 2019, now's the time. So that kind of leads me to my first recommendation, is that if there's ever a time to do it, now is it. The critical need that we have to do is slow down just a bit and focus on your security and your HIPAA compliance efforts. If you're fearing where your revenue is going to be coming from, then we certainly respect that. We understand that very much so. What we don't want to compound is normal cash flow issues, extra normal cash flow issues, with a breach or a hack or a disaster that could have been easily or more easily overcome had the right protections been in place. I think some of the things that we really want to double down and highly recommend our clients to address is a regular security thought process. The NIST concept of making security and compliance and risk assessments part of your workflow and a regular process has never been more relevant and important.
I couldn't agree more, but it's easy to be distracted right now, Henry, as you said, and it's really easy, and I know we'll touch on this possibly a little bit later, but it's easy to, with perhaps the volume in your organization being down and with revenue following it, it's easy to make those decisions, say, well, this is some place that we can trim or we can hold back on, and in fact, you actually may be more vulnerable now than you were before, and those are hard decisions, but you need to look hard at that.
Definitely. Yep. The thought process there is just like you said, Tim. So much of this is changing, and it's just a phenomenal opportunity to really make the most of this and focus on things if you can possibly squeeze it out there. This may not be urgent from a lot of people's perspectives, but it is so much more important than it ever has been.
Like so many other decisions that you make, Henry, sometimes you have to be able to come in and say, we know we need 3 or 4 different things to really bolster our security and compliance, But you may need to triage that and say, but here are some of the areas that we are most vulnerable. And so if I have limited financial resources to devote to this, and most everybody does on a good day, what do we hit first? What gives us the most bang for our buck, and then focus on that? And that's someplace, that's an area where a good partner like Turnkey can help you zero in on those areas.
You bet. A lot of this stuff doesn't have to cost money. It does cost something. It's going to cost somebody some time and focus and attention. But doing the things that are most important and most impactful, well, that's the job of any leadership in any organization, is because there's never a day when we don't get asked for more things than we have money or time for. And
Fair enough.
It's about picking what's most impactful, right?
Mm-hmm.
Yeah. All right. Well, so one of the things that we have learned in the years of doing this that's most impactful is to kind of reiterate that is it doesn't have to cost a barrel of money, but to recommit your organization to security and compliance reviews, the thought process and the mental and organizational commitment to let's spend some time thinking through that. Cybersecurity training and testing should really be redoubled. This environment has changed. Your work environment has changed. Your vendors' work environments have all changed. And from the provider down to the janitor, everybody should be looking at some fresh training on a regular basis around what do we do? How what are the new threats? How do we protect ourselves? The basics around go ahead.
Another point that I want to kind of augment what you're saying, Henry, is you got to have a compliance mindset when you're talking about recommitting to security and compliance reviews, and that comes from the top. And so many of the folks on this session are leaders in their organization, and so that makes a huge difference when you have a compliance mindset that's coming from the top of your organization.
It's so huge because nobody at the bottom wants to do this if the leadership doesn't push it and stress the importance of it and train around the importance of it, to say this is why this is important, this is why we're doing this, and as an organization we're going to double down on this. I think that's kind of the only way you're going to get the rest of the troops to back your play, so to speak.
Yep.
Yeah. The real basic stuff, the techie stuff, and there are some tools and things around this that are important and highly relevant of putting good stuff, especially as we look towards kind of phasing out of this quarantine. Now the idea around the remote workforce is really getting a lot of second looks or third or fourth looks. And if you're going to stay in that environment, we really need to think through how do we put the same enterprise-grade protections where the workers are. And there are a lot of great technical solutions for that don't have to break the bank. But if you're going to leave people outside of your corporate network, then we do have to protect them at the same level that you're protecting the computers inside your building. And kind of
well, Henry, if somebody is standing up, remote working or what have you, and your staff, this could be a significant investment, or maybe you've already done it, but you need to go back and fortify. Again, have a plan, and you may not can give everybody commercial grade appliances to make this totally optimal, but you can certainly say, who are the biggest users, who do I need to protect first, and slowly but surely roll this out. Just have a plan. I think that actually ends up helping you if something dastardly were to happen and you had to face a HIPAA compliance matter, to say, look, we had a plan and we were, 40% there, 60% there as we rolled this stuff out as we can afford it. But to say it's just too overwhelming, so we're not going to do anything, probably isn't going to take you very far.
It's going to be bad. I don't know about everybody else on this call, but we've been through a lot of HIPAA audits where an organization was asked for the hard questions about where's your latest risk assessment, where's your policies, where's your procedures, and we have never found an organization, ourselves, business associates, covered entities, anybody who is perfectly HIPAA compliant. But we have also never seen somebody get fined for just the random spot check audits that was admitting that they were not perfectly compliant and had a plan in place for addressing some, if not all, of the issues. So being aware and having that plan is so powerful in our perspective.
Agreed.
All right. Little more basics, simple things, is, like you said, just keeping the basic protections and the level of precautions in place that you have elsewhere, that you were doing before COVID, and have those protections in place across the board. We can't take our eye off the ball because the hackers just aren't. They're getting more to work than the rest of us are, and that kind of sadly to segue from the tech components and the idea of security and compliance reviews. Tim, I wanted to share this idea that the reality is that sometimes the technology just fails. I'm a big proponent of great technology, of having the IT protections, the antivirus and the firewalls and the VPNs and all the other protections that are important and critical in place. But I don't know if you can read this. The guy is having problems with his computer, and turns out the antivirus program didn't catch it because it wasn't a virus. It was, in this instance, they said it was a bacterium. In my world, we come up with crazy new threats like, okay, this wasn't a virus, it was malware. This wasn't a malware, it was a bot. It wasn't a bot, it was now the PUP, or potentially unwanted program. Or in my industry, we throw out three-letter acronyms, I think almost as fast as almost any other industry out there. But the reality is that sometimes the tech doesn't work. At least from our perspective, sometimes the hackers are one step ahead, or the software or the hardware is one step behind. It doesn't matter. And what do you do? What do you do when the IT stuff doesn't catch the problems?
And social engineering, that's how some of the malicious players bypass that. They get you to do it for them by social engineering. So training, you were mentioning policies a while ago, training is huge. And then again, having the compliance mindset will help that. But it's so easy, and I've seen it too many times where we've had instances or near instances where it was mostly the user not paying close attention.
Yep. And that's a fantastic. Thank you for the segue there, Tim. So many times the users have been proven, and the staff and the office managers can do all that they can to promote great standards on the computers and the technology and the backups and all that. But if a human being asks or provides the password to the hacker through either on the phone or email or whatever, there's very little that the tech can do to stop that, or that the technology can do to stop that. So I'll kind of throw this out there, is that our third really critical need that we just cannot recommend enough, and as a little bit more seasoned organization, we've been doing this for a few years now, and we're starting to kind of really feel the importance of some of the basics that have really helped big organizations and very successful organizations for as long as people have been writing business books, is the idea that you got to have great policies and procedures. I heard it a few times from a great mentor of ours that here at Turnkey Solutions is that in stressful times, when it's really bad, when the chips are down, when stuff is flying, and everything is broken or things are just not going right, your average employee will not. As much as we'd love them to, they're not going to rise to the occasion. Your average employee is going to fall back down to the level of training and policy documentation and procedure documentation that you've put out there for them. So,
agreed. Yeah.
That how that plays out is and the high level ones that we think are just more critical now than ever. Do you have a full stack of current policies for HIPAA and cybersecurity? Tim, do you ever look at your HIPAA policies and blow the dust off of them every now and then?
Yeah, that's a great analogy. If you can take a white glove and go swipe the notebook where your policies and procedures are housed, that'll tell you a lot.
Yeah.
But we also try to think through situations where we either hear something, we hear the bad circumstances that a fellow practice maybe have encountered. How would we react? Or we have a near miss on our end. What do we need to do from a policy standpoint? Those are great times to really update the policies in a kind of contemporaneous manner. And of course, we don't always have time to do that, so we reach for outside help on that.
Yeah. Yep. When the policy was reviewed, if I'm not mistaken, I think HIPAA basic guidelines is that it says that your policies have to be reviewed regularly, and it doesn't specify if they've got to be reviewed every week or every month or every 24 months. It doesn't specify a real hard time frame. The guidance that we've always kind of leaned on is that the policies need to be reviewed on a regular basis through some sort of procedure, and oftentimes an event can drive an immediate need to review. Like here in Louisiana, we all reach for our disaster recovery plan when the first hurricane gets into the Gulf. And like you said, every time somebody else falls or hits the news, or you hear about a peer having a problem, that's a phenomenal opportunity. It is sadly it's a gift to you to say, okay, let me stop and think through what would happen if that happened to my organization. How would we respond? So
right.
That's a phenomenal prompt to please stop and look at your review. Don't just say, glad it wasn't me. So, the other fun thing that we in my company have really found value in is retraining the staff on where the policies are. We store ours up on an intraweb somewhere, but if your staff doesn't know exactly where it's at and they can't go to find them and search them and do it, I think it's to some degree kind of like the tree that falls in the forest and nobody's around. We're not really sure if it made any sound or not, but if you have a great policy and nobody knows where it's at, you kind of, I don't know, it's not highly effective use of your time writing that policy.
Right.
Yeah. Some of the basic policies that we find, and I'll kind of highlight a few that you and I have talked about over the last year or so, Tim, in some policies and procedures that if we really want to dig into the weeds just a little bit, that are really effective or really timely, and from the IT perspective, we don't see a lot of people having very mature practices around this, but these are some of the things that quite frankly are very easily overlooked. Is mobile device management. Everybody uses their iPhones and Androids and tablets and whatever to access stuff, and it is almost perfectly inevitable that at some point or another you're accessing PHI in a medical practice through your devices. Do you see that as going away or commonplace in your practice, Tim?
It's actually a commonplace, and it just becomes more and more prevalent. I mean, even if you were to issue practice-owned, organization-owned mobile devices to people to use, they're still going to inevitably, perfectly as you said, use their own owned devices. And so you've got to have a plan around that.
Yeah. They're just having a plan, having a standard, thinking it through. If you Google or if you go to the wall of shame on the HHS's website, there are so many of them that are breaches, so many HIPAA breaches that are caused by mobile devices being stolen, hacked, and whatnot. That it's a simple area. It's very common, and it's going to get more common. The next one is the concept around passwords, and this is I'm very passionate around this because I understand that the providers, the doctors, are working very fast, and they're being pressed for time, and they don't have 4 or 5 minutes every time they sit at a computer to log in. They don't even have a minute. They don't even have 30 seconds to sit there and log in and do all kind of stuff. So when we slow them down by creating huge passwords or by using some kind of multi-factor authentication or something, we got to have a great use case, and we got to have a great story. We got to really be able to justify that. But the short version is that short, weak passwords, you might as well not have one.
Agreed.
Yeah. The fear factor there is that the next piece, the next logical step that almost everybody goes to, is that we're storing passwords all over the place. And if you don't believe me, go check your browser. If you look at your saved information in there, almost every computer we ever look at, and we see thousands of computers throughout the course of a year, they almost all have stored passwords in the browser. The browser has kind of become the new sticky note that we used to struggle with picking up the keyboard and finding 5 sticky notes underneath it, or just the sticky notes on the monitor. We still see those, but nowadays the browsers are doing that. And if you think about it, your browser is replicating those passwords up into the cloud and storing them God knows where. So if you're storing your password for your EMR or your bank or your Facebook account or your email in your browser, then that's being spread all over the place. I don't know. I think the idea of having a plan and a policy around that and a standard that your organization drives around these 3 things, around the strength of your passwords, around what are we going to do about mobile device management, and where can we store passwords as an organization. Those are 3 security standards that I think every organization that struggles with or is compliance with HIPAA just really must address.
Agreed. And those are not typically encrypted when they're stored in a browser. And so to wag your finger at folks in your practice, especially the providers who oftentimes are the partners, which is to say they're ultimately your boss, it probably isn't all that helpful because you haven't given them an alternative. And it's so easy because they do it at home and they store that. So having an enterprise solution to be able to say, you need complex passwords, this is an easy way to manage them, and it is encrypted, and please use this. And then I think there's a lot less resistance, although we all know, as you said earlier, the providers are busy and they don't want to be bogged down with that. But to say don't do that, but then not to give them a solution or alternative is probably a shortcoming.
Definitely. It's a huge shortcoming. And look, here's the reality, is that the industry, the IT industry and the healthcare industry both get it, that these 3 things and so many, all the other HIPAA security standards, we get it that they're real, and they're all been addressed with strong, very effective technical solutions. And these 3 specifically, there are some very good solutions in the industry that, software packages or hardware packages are just solutions, but none of those technology solutions are nearly as effective if they're not first off driven by a standard that your organization agrees to and a policy that says here's how we're going to do it, and then it's being communicated out to your team that, hey, we're going to use this tool and here's why and here's how to use it and this is how it helps us.
Yeah, the training is huge too.
Oh, yeah. None of the tools are useful without some degree or a lot of training. One of the other things that we deal with a lot, kind of to that point, Tim, is the idea of how are you dealing with your internal team on training, and how are you dealing with your vendors, specifically every organization that's a covered entity needs to have somebody named as the compliance officer, right?
Correct.
And are they trained? Have you done anything other than giving them the title and the responsibility? Have they ever been through any kind of formal training? Do you keep them trained up? Do you really kind of encourage that? And if from our perspective, when we're dealing with a healthcare organization, one of the first things we ask is who is the compliance officer, and then we try to really work through, okay, how much training do you have? Where are your blind spots? What do you need? And are we on some sort of program and regular training program? Because this stuff changes too much, too fast.
It does.
So the hard, kind of awkward question sometimes is your partners and your vendors, and I find myself in both situations. I've got partners, I've got vendors. Sometimes I am a partner, and sometimes I am a vendor, and depending on what relationship we're looking at. And so we have to ask these questions, and we fully expect to be asked these questions about, what's their what are your vendors' training protocols for their staff, what are their security controls, and what are their insurance policies?
Correct, because if they trigger an incident, let's say it's your partner who actually, in essence, is liable for the instance that you now suffer, mm-hmm. and that's going to fall on you. Mm-hmm. You better be able to go look back at your partner and say, hey, do you have an insurance policy here? And like to your point, Henry, it's a little bit awkward, but in today's healthcare environment, especially with the use of business associates agreements, BAAs, it's a question that's needed to be asked.
You gotta ask it. If you read your basic BAA agreement, the one that everybody downloads, and uses that template, it really heavily implies that you understand their insurance policy and their controls, and that they understand yours and your requirements. And just signing the agreement is pretty dangerous unless you actually have that understanding and have those hard conversations.
Couldn't agree more.
Yeah. I guess the kind of final wrap up after those four points and those four critical things is that from our perspective and as implementers and consultants, I feel like these are legitimately some very challenging times. It is stressful for the practice managers. Things are changing extraordinarily rapidly, and there are very hard decisions that are being made or should be made along the lines of where do we spend our money, where are the risks, where do I spend my time and my focus, and I don't know, are there other huge things that are kind of hard decisions that you see your peers or your organization thinking through, Tim?
We absolutely face these same hard decisions and have over the years. And so one of the understandings that I shared with our partners is that healthcare data has an extremely high value. You can harvest healthcare data and sit on it, you don't even know you've been hacked or had a breach or robbed of your data, for lack of a better term, because it has a longer shelf life. And then people can use this down the line in a malicious way. And it has a higher value than, say, your credit card that's stolen, because a stolen credit card number has a very short shelf life, relatively speaking, so it's not as valuable. And I'm not going to quote any hard numbers here, but they're very small for a credit card. They're much larger for healthcare. So when it comes time to try to make some of these hard decisions, I think it's important that your partners, your owners, understand that, having an insurance policy or paying to have these policies made and the retraining and all the other points that you've made, Henry, is so very important. But it's also a lot less expensive than the financial expense and the rigor of going through a breach and having to report it and being listed on the wall of shame at the OIG. And because many of us are smaller organizations relative to the big payers like Blue Cross and Aetna and people like that, and Target, folks that have been in the news that have had breaches. If those folks with their big budgets can be breached, then us little folks certainly would be targets. And one could fool yourself into thinking that we're so small that we're actually off the radar, when in fact you're small and might be easy pickings. And to harvest 200 patient names and all their patient demographics can be worth the effort. So when you think about it in terms of the cost to buy this appliance or do some of the things that you've recommended, Henry, versus the other side, what are the consequences? What are the financial consequences of having good equipment, having good insurance policies, and just the cost of the penalties?
Yep.
It makes the hard decisions a little less hard to sell. And I know that folks who are administrators in their practice like me, who have to go try to convince the owners that this is the right thing to do, it's often not easy.
It's not. And that's where being armed with the facts is so powerful. If you have the facts, you can have a decision that's based around not just emotions and fear and uncertainty and doubt, but around here's really honestly here's the weak points, here's how we're going to fix them, here's some issues, here's the plan. And like we talked about earlier, Tim, we're not going to be able to fix everything, or we're not going to be able to address every need, every problem that everybody brings us. But if we have the facts and we have the issues in front of us, then we can really start to deal with the ones that are high impact, that are going to make the biggest bang for our buck when we go to improve them. And
I agree. And if I knew the day that my house was going to burn down, God forbid, or my business, I'd buy fire insurance the week before, and I'd be just fine. That's right. Not how it works. Yep. And it's the same with ransomware, and it's the same with some of these other instances that you've talked about. So you've got to protect yourself and protect your organization.
That is so true. So the idea around how do we deal with our risks, and how do we find our risks, and how do we understand what that game plan is, I've got great news for you. The idea around that is something that we deal with on a daily basis, and I'll throw this out there that's something we do here at Turnkey Solutions. And the first step for this is absolutely no cost. If you're on this webinar right now, there is a very rigorous threat assessment and dark web scan that we've spent the last 13 years fine-tuning it, and really spent years and years making it more effective and more directly focused at the needs and concerns of a practice manager. If you need to really have a factual-based conversation with, like you said, the doctors who are often the boss and the owner of the practice, then we can provide you that tool, that fact-based assessment around this, and for a limited time only, for a few folks, we're able to provide that at no cost. How that works is at the end of the process, we're going to be able to share with you where your dark web exposure is. Like, I'm going to be able to show you your usernames and passwords that are out there being actively sold. And there is never a time that I do that people don't typically say, okay, well, we appreciate this meeting. I got to go take care of something. There's always something on that. It's sad but true. Next, we're going to kind of walk through and show you high-level things and as much detail as you want to dig in about where your systems are protected from hackers and criminals and rogue employees, which are often as much of a risk as the criminals, and a health score, a basic factual number that will let you know, if we work on this, if I have let's just say if I have a C on this particular part of my network, I now have a goal. I can work towards getting that to a B. If I have an issue here, here's if I need to lose weight or do X, Y, and Z things, we want to start with a number and move forward with that, and that's the plan. Additionally, the other things that we look towards helping with and presenting is how is your backup plan and how is your disaster recovery plan? Is it prepared for your network being completely hit by hackers? Is it prepared for if you have a fire or a hurricane? And how is that going to protect you in those scenarios? At the end of it, you're going to get the full report on the dark web scan, and as well as the scores on how your network is prepared for those disasters and for those scenarios. There is also, as a special edition, we have a phenomenal guide that your staff will find really helpful, that is a report on how to create and manage hacker-proof passwords. There is just so many great tools out there, and everybody's got different passwords all over the place, and we talked about this, but we'll also provide you that as just a great checklist and walkthrough and training piece, and it's a very effective thing to kind of arm and prepare you with, and it will get you that much closer to having your full policy prepared. So when we talk about things that you can walk out of this webinar with, we can get you prepared with that policy. Check, done, completed, ready to roll. So no obligation. We don't deal in requirements around that. If you want the risk assessment and you sign up and you're eligible for it, then and you ask us to do this, we'll talk about it for a minute and explain it in more detail with you. But there's absolutely zero obligation to buy anything or to do business down the road. We're just purely in an engagement of education. I really can't do this for everybody. And it's by booked appointment only. We only have so much time available because it does take about a day's worth of work. So I would urge you to hop on and apply for this, or just not so much apply, but just request the service. And we can only do about 4 or 5 of these a month, so at no cost. So please go to tcas.la/cyber audit. Go ahead and take care of that now. It's tcas.la/cyber audit. You can look through that. We'll have a conversation first with you before we start off with anything, so we can kind of answer any questions. But that's the first step, and just get us your information and say, hey, look, I'd like to talk more about this. And I would just kind of leave with the idea that we just, unfortunately, like you said earlier, Tim, we just can't think it's not going to happen to us. Like you said, if I knew the day that my tires were going to blow, I would go buy new ones the day before. But we just don't know when the next thing is going to happen, and we don't know when the hackers are going to find our network, and we just need to be prepared now. So,
if you can predict it, you can prevent it.
That's the truth. That is so true. Well, Tim, I got to tell you, I really appreciate your time and your friendship and your just working with you over the years, and we thank you so much for joining us today. Do you mind if people ask you questions afterwards? I hope not. Because
not at all, Henry. It was my pleasure to speak with you again today and to speak with this group.
Awesome. Well, thank you very much. If y'all have any questions after this, here's Tim's information on the screen and also my information. It has been an absolute pleasure to share these 4 critical protections that everybody needs to have to protect your healthcare practice or your HIPAA compliant organization in these times. And we hope to hear from you soon. And with that, we will wrap up the webinar, and we'll talk to you all down the road. Thank you, Tim.
You bet. Take care.
All right.